In today's Health Alert, the World Health Organization updating the status of a new coronavirus strain. It's been reclassified as a variant of interest. Our chief health editor, Dr. Partha Nandi, joins us now. And Dr. Nandi, why did the organization upgrade this classification, and what is the risk from this family of viruses?
Yeah, it's like here we go again, right? Previously, the World Health Organization classified the BA.286 strain as a variant under monitoring. They notched up the status because it's spreading more widely globally. In fact, here in the U.S., cases have actually tripled in the past 2 weeks, Lena, and by calling it a variant of interest, this encourages global monitoring and more research to understand if it causes more severe illness or is it better at evading immunity. And now when BA.286 emerged, it raised concerns in the health community. Why? Because it shared many similarities with the original Omicron strain, which spread very rapidly, caused a high number of hospitalizations and deaths worldwide. And with over 30 mutations, well, scientists worried that it could possibly evade immunity from both vaccinations and previous infections, potentially causing another surge, which we don't need. However, research found that it did not entirely escape the body's immune response, and the current vaccine provides some level of protection against it. Now, regarding the current risk from the group of viruses, the World Health Organization, they say that the risk seems to be low at the moment. Again, good news. However, it's essential to keep in mind that the virus is continuously evolving, and we now have the JN1 subvariant, which is spreading faster than BA.286.
So we just talked about this, the Biden administration sending COVID tests to schools. Can you tell us any more about it?
Yeah, I think it's a good idea. You know, the Department of Education sent letters to schools encouraging to use these free tests, which are, I think, very easy to use. Now, schools have the flexibility to store them in nurses' offices, main offices, or distribute them to students and parents. And school districts can start ordering these tests as early as December. And as we know, kids spend a lot of time inside, especially during the winter months, which gives them the virus is actually plenty of opportunity to spread. So testing is super important so that anyone who's sick, well, they can stay at home. But I also want to stress once more the importance of getting the new COVID-19 vaccine. I got vaccinated earlier in November, and that's because I knew that 18,000 Americans were admitted to hospital with COVID-19 in the past week, marking a roughly 10% rise compared to the previous week, according to the CDC. Data tells us that the levels of coronavirus detected in wastewater nationally are notably high and seem to be on the rise, and this could indicate a potential increase in the case number. So I think it's best to protect yourself and your loved ones by getting vaccinated. And the wastewater tells you that the community prevalence is increasing. So if we can protect ourselves, some people say, well, listen, it's not going to affect me, but you protect others that are more vulnerable.
And that's the key.
Yeah, because all of us can stay safe then. You know what I mean? So.
Yeah. Thanks a lot, Doc. Appreciate it.
My pleasure, of course.
All right. Be sure to tune in this week to another episode of the Dr. Nandi Show. He's talking about the world of music therapy, deep diving into that with therapists shedding a light on the benefits of this practice. That's December 4th, 2:30 a.m. right here on 7.